Now, it took, what, 3.5 months?
It took 3.5 months.
And you tell me a story.
Yeah. This is the before shot. The as you can see, I mean, it doesn't really require an explanation. And then I went through a process of having some braces to straighten my teeth first, and it became really apparent then how much I had ground off my teeth because they were really uneven. We had 2 points that this point here and the eye tooth here, which gave an indication of how long my teeth had been,
Exactly.
and from that, Dr. Sarkis was able to do a really good mock-up of what I would look like, and this is now the finished.
I mean, how good does it look? I'm not saying I did the work. I mean, you tell me.
Well, you did. And I think it's actually changed my whole mouth structure. Like you can particularly see it on a side shot. On a profile shot, where my mouth, the whole structure of the bottom of my face, just kind of was more atrophied, and since having my new teeth in, it just looks fuller all around.
Well, I mean, how young do you think you look in this picture? I mean, seriously.
Oh, maybe 5 years younger.
Oh no, I'm more.
Well,
more.
Yeah,
I'll say 10.
Yeah, thanks.
I'll say 10.
But, it's just.
I'll tell you why you look 10 years younger. You got a lip, you got a face, your mouth is fuller. You can open up your lower facial height. We've actually opened up the lower facial volume. We've opened up.
Yeah.
That.
Yeah.
You know,
Yeah.
from there.
Yeah. And that. Yeah.
Less grooves, less folds.
Yeah. And it's only really when you see this comparison, the before and after, where you can actually notice those really kind of, they're almost like indiscernible differences that even a friend or a family member may not notice, but they just are able to say.
It's a subtle and yet it's elegant, isn't it? It's subtle yet
it's
subtle,
elegant. But it's not subtle when you see the before and after shots right next to each other. That's when it's really obvious.
Okay, it is, but in a way it looks nice. It doesn't look like it's been done up, you know. You don't feel like, you know, people have their face done up with plastic, but yours is not done up. It looks good. I just feel it. Let's go to the next one. I mean, we went from initial presentation. It took 9 weeks. Okay, this is after the orthodontics, right?
So that's what I was doing
that little tips.
That point there.
And then we have a diagnostic mock-up. I mean, how close is that diagnostic mock-up to your teeth?
Really?
Interesting, isn't it? I mean, when we go back, look at that. It's pretty close.
Yeah, very close.
All right. Now let's going back here again. Okay. Now we've achieved. Look at the improvement in the facial volume. Look how we improved. The whole face. It's really improved immensely.
Yeah. Okay.
And now we're going to the profile.
The profile shot. Yeah.
You know?
Yeah. That's. It's like my chin. Just. I don't even know how to describe it. It's like that.
Well, I think we've done. We brought the whole face.
Yeah.
Upper and lower forward.
Yeah.
And we pull your cheeks back. We've grown a bone on your mid-face that you were missing. And normally with females the aging starts a lot quicker, as you know. So we've actually have grown bone to place the teeth in the right place in the arch. We also improved the position of the arch and the shape of the arch. By improving the position and shape of the arch, then we're able to put the teeth in the right position. But if you try to put veneers without doing this procedure in patients in your category, you will not get the results. You will get thicker and uglier veneers. That's why when they place those veneers, it doesn't look right. In your case, it fits the face. That was okay. Now, what do you see then, Maryanne? Tell me.
Oh, I just see a huge difference in how it's like that whole part of my face has come out, whereas that looks more atrophied, which has made my chin look longer, and
it's more here. It's more here, I think, isn't it?
Yeah.
It's more here.
Yeah.
So what we did in 6 weeks, you could see the difference in improving the arch form.
Yeah.
But this is 6 weeks.
Yeah.
In
right.
9 weeks, it was totally different.
Yeah, looks remarkably different. Yeah, it's really impressive, and it's surprising to me how normal my mouth feels. Like where I'm talking and eating and not actually conscious of my teeth, which is really great. Yeah.
I mean, I'm amazed. Again, I've done the work, and you helped me to do this work. I'm simply amazed how the changes have occurred. For instance, I look at, for instance, the case here, for instance, right? And maybe looking at the case here, and your chin is more prominent, and actually the chin is in the right position.
Yeah.
Is the upper arch is sunken in.
Yeah,
to bring
that's
the upper
right.
arch forward and through the folds.
Yeah.
And here we actually move the upper arch forward. It's not finished yet, but we know the chin is less prominent there.
Yeah.
You have lesser folds on that side.
Yeah.
Okay.
Yeah.
And we had bitten another 3 weeks of work, another 3 weeks of work, and 9 weeks. And now we've got the teeth in the right position, and veneers went in. I mean, what a difference. I mean, let me tell you, you had no plastic surgery done, have you?
No.
Okay.
No.
You had no lip injectables.
No.
Is that correct?
Yeah, absolutely.
Did you have any cosmetic augmentation procedures done
No.
on your face? No.
No.
That's what I'm trying to say.
Yeah.
See, when you put fillers without having the right scaffolding, it's not going to work. And that's the key to good aesthetics. I think this is very, very important. We've achieved that. Well, what can I say? I would say, Sylvia, also, the pleasure was mine.
Thank you, Dr. Sutton.
Thank you very much.
Yeah,
and,
I'm really happy with the outcome. Yeah.
Thank you very much. Pleasure was mine, I must tell you. And what was one critical thing that made you see the result that there were two critical things, I would say. One was the diagnostic mock-up, wasn't it?
Yeah.
The one was the diagnostic mock-up when we did initially first time, and then we came back and we did that again over here, right?
Yeah.
Would that be correct?
Yeah.
All right.
Definitely.
We knew where we were going.
Yeah.
So we got you in middle one here. We got the arch in the right position, correct?
Yeah.
Okay. Here we got the diagnostic mock-up.
Yeah.
All right. Here we went back. That's your profile, and that's a smile. So that's from diagnostic mock-up, correct?
Yeah.
All right.
Yeah.
But most importantly, is we never really cut your teeth.
No, you didn't. No, we didn't do
And
anything.
we didn't give you an local anesthetic for all this, did we?
No, that's right.
We preserved your enamel.
Yeah, that's exactly right. Yep.
Okay.
There was. You left my teeth intact.
Intact.
Yeah.
Now, what is your profession?
I'm a psychologist.
You're a clinical psychologist, right? And this was the most important driving factor for you, wasn't it? If you think about it, if I could put at one point and say, here's a critical decision-making situation.
For me, it was primarily a functional issue in that I was grinding my teeth and I could tell that it had that I had actually ground a few millimeters off my teeth and that it was going to get worse. And the second factor was the aesthetics. And the aesthetics now kind of shadow the fact that I had a functional issue, really, which was I was grinding my teeth and it was, I didn't want to end up having implants. That would have been a whole lot worse. So
you got no intention of, you want to preserve teeth.
Yeah.
I mean, the most important thing is that there's too much talk about dental implants and they forget to actually save the teeth. And I agree with you. I agree. As a specialist, my key importance in my input into the profession is to save teeth at all costs. Well, I'd like to thank you for allowing me to do the treatment for you. The fact that allowing me to share your case with other people who really need this sort of work to be done. The most important thing is that we conserve biology, we preserve biology, which is the most important part of the restorative process. Yeah. And the fact that we've restored function, we restored comfort, we improved aesthetics. I think that's what we had to do without cutting teeth. I mean, that's what should be done today. This is so you are one of the history making as a patient. You're a history making process because there's a whole new way of doing things. You're very healthy. I'm not going to say. I mean, how young are you? Can I ask?
I'm 61.
61. My God, you don't look 61 at all. Anyway, you're not 45 range. I have to tell you. That's my opinion, naturally. Thank you so much.
Thanks.
Thank you.
Dr. Science.
Stay there for 1 sec. Stay there. Can I have that?